Hello viewers, Ben Daktari here again. It's a bright evening that the Lord has given unto us. So I'm a medical practitioner. I work in the laboratory. So I'm the person who do tests, both blood, stool, name them. So today I'm going to be talking about a certain disease that is affecting most of us in most cases. But before we discuss the disease, so if you are watching this video for the very first time, kindly hit the subscribe button, like the video, share, and give me a thumbnail. That will be perfect. So let me jump straight to the point. Today I'm going to talk about diabetes. I'm going to teach you what diabetes is, and tell you what the causes, the symptoms, how to treat it, how we can prevent it if you don't want to get it. Yeah. So what is diabetes? When a person asks you what diabetes is, what can you tell him or her? So diabetes is this is a condition when you are told that you are having high blood sugar or high blood glucose. So the blood glucose is very high. So I'll advise you to take a book and a pen so that you write something down, because this information is very important. So as we continue, as I have told you that diabetes is a condition where you are being told that you're having high blood glucose or high blood sugar levels. So there are those normal ranges in which your blood sugar should be. So the normal blood sugar, it is put in two different categories. That is fasting blood sugar and random blood sugar. When I say fasting blood sugar, that test is done after you've been fasting. You've not been eating for a certain period of time. And then random blood sugar, it's just done randomly. So there are normal ranges. For example, for the fasting blood sugar, the normal ranges should be below 5.5 millimole per liter. Below 5.5 millimole per liter. That is fasting blood sugar. You've not been eating, so your blood sugar level should be below 5.5. Now, if you have been eating, that is when you are doing a test called random blood sugar. The blood sugar level should be below 10 millimole per liter. These are the machines that gives values in hundreds, in a value under a value called named that or termed as milligrams per deciliter. If you have a machine like that one, if you divide that value by 18. So if you're having a machine that gives you a value in milligrams per deciliter, you divide the value by 18. That is 18. That is why I told you it is important to get a book and a pen for such information. But there are these other machines like OnCall Plus. They give you a value in millimole per liter. So for the random blood sugar, the normal level should be below 10 millimole per liter. Millimole per liter. So if you're having the other machine that gives a value in milligrams per liter per deciliter, you divide by 18. That is normal ranges. What about abnormal ranges? Abnormal ranges for the fasting blood sugar. Fasting blood sugar, you'll get that the value is above 7 millimole per liter. That is fasting blood sugar. You've not been eating, so your fasting blood sugar should be below 7. That is normal. But abnormal, it is above 7. What about random blood sugar abnormal ranges? You'll get that the abnormal ranges is above 11.1 millimole per liter. Hope I'm very clear. There are these normal and abnormal. So I've given you the values where you're supposed to be. If you're normal, for the fasting blood sugar and random blood sugar, and abnormal fasting and random blood sugar. In diabetes, we have different types of diabetes. We have type 1 diabetes, we have type 2 diabetes, we have pre-diabetes, and number 4 we have gestational diabetes. So there are only 4 types: type 1 diabetes, type 2 diabetes, gestational diabetes, and pre-diabetes. So today, in this video, I'll be covering type 1 diabetes. Type 1 diabetes. So what is type 1 diabetes? In our bodies, we have different organs like the pancreas, the liver, the kidney, you name them. You know their work. So for the sugars is broken down, or it is regulated in the pancreas. So the pancreas has a pancreatic or produces a pancreatic juice. The pancreatic juice produces enzymes and hormones. In the hormones, we have insulin and glycogen. So insulin, it is a hormone that is used to lower the level of blood sugar. So when your blood sugar is too high, the insulin comes in so that it regulates it by lowering it. On the other side, there's other hormone called glycogen. Glycogen, when your blood sugar is very low, it raises your blood sugar. So when you are told that you're having type 1 diabetes, this is where the cells of the pancreas are destroyed, in that they do not produce insulin at all. Insulin is not produced at all. That is type 1. So that simply means the level of blood sugar, when it raises, the insulin is absent to reduce it. Yeah, so it is just goes high. That is when you're told that you're having type 1 diabetes. Yeah. So in the pancreas, I told you that there are enzymes and hormones. So I've told you the enzymes, the hormones. So now I'll tell you the enzymes that are produced by the pancreas. One enzyme, it is called trypsin and chymotrypsin. Those are enzymes. These enzymes they're used to digest proteins. The second enzyme is called amylase. Amylase, it's used to break down carbohydrates or starch. There is another enzyme called lipase. Lipase, it is used to break down proteins. Another enzyme, there are so many enzymes, but I'll just tackle trypsin and chymotrypsin for proteins, enzyme amylase for carbohydrates, and enzyme lipase for breaking down lipids. So this type 1 diabetes, it's most common in adolescent stages. So for these people who are the adolescent stages, it's very common. When your body has enough sugars, the excess is taken and stored in the liver and the muscle cells, yeah, or the muscle tissues, so that when your blood sugar is low, so it is stored in the form of glycogen. When it is enough in your blood sugar, that simply means it's not high, it's not low, it is enough. So the extra is stored in tissues like muscles and liver in form of glycogen, so that when your body needs some sugars, it is broken down during exercises, when you are doing those vigorous activities. So when your body needs energy, so that's when the excess, which is stored in form of glycogen, it is broken down to release energy. So I told you, when you're having type 1 diabetes, it is where your body is unable to produce insulin. Yeah. your body is unable to produce insulin. So the amount of blood sugar is not maintained, it is not controlled. Yeah. And when you're having too much glucose in your body, it causes two things, either short term or long term. For the short term, it is when you treat it. Okay, you've gone for a test, you've seen that you're having diabetes, so you take a step of treating it. So that will be short term. But there's this other term called long term or chronic. This appears when you have diabetes, you don't know, you recognize it, or you know that you're having diabetes at a later period, after a long period. You've been having it, but you discover that too late. So that will lead to long term, because that diabetes will be grown. So I'm going to tell you about the signs and symptoms, and here I'm going to tackle on the symptoms. So when you're having diabetes, or what are the symptoms of you knowing that, or assuming that, or guessing, or suspecting that you're having diabetes? These are the symptoms that your body will portray. The first symptom is excessive thirst, the urge to drink a lot of water. Yeah, you want to drink a lot of water every time. When it is cold, you need to drink. When it is hot, you are just feeling like drinking water. Another one is excessive urination or frequent urination. Another symptom is you're feeling hungry every now and then. Every time you've been eating, but after a short period, you are feeling hungry. Another symptom is dramatic weight loss within a short period of time. For those people who are, you're having a good weight, but now when you go to take your weight, you see that your weight is dramatically going down. This is not because you are sick, no, but it's just going down dramatically. Yeah. Yes. Then there's another symptom called blood vision. Yeah, poor visibility. It is you cannot see well through the dark. Blood vision, or even during the day, you can just get a blackout, just mara moja poor. Yeah. So if you're having such symptoms like excessive hunger, frequent urination, feeling thirst every now and then, a dramatic weight loss, feeling hungry every now and then, I urge you to go and test. You go have a diabetes test, and so that you know where your body or your life is going. It is not good, so go have that test. If you go to the lab, you just tell them you need a blood sugar test. They'll test you. So if this type 1 diabetes, it is not treated, this type 1 diabetes, if it is not treated, it leads to a complication called ketoacidosis. What is ketoacidosis? This is where the body produces excess levels of or high levels of blood acids. Yeah, when the body produces high levels of blood acids called ketones. So when you're going to the hospital, in the lab, they take blood, and sometimes they take urine. For the urine, they're taking that component called ketones. So what are the symptoms that tells you that you're having glucose or you're having ketoacidosis? These are the symptoms: rapid breathing. You're breathing rapidly. Yeah. Number 2, dry skin and mouth. Have you seen when you're walking through the town, you see there are people who are having a dry mouth. So don't judge them, but because some are maybe it is hungry, that it is hunger, sometimes it's thirst. So when you're having dry skin or dry mouth, I urge you, please, you go test for the blood sugar test. Another one is flushed face. Another one is fruity breath. odor. You're producing a smell in your mouth that is fruit, is having a fruits, yeah, fruit, kizungu, fruity odor. Then another one is you're feeling nausea. Sometimes you may vomit and experience stomach pains. So for the stomach pains is because of production of that high levels of blood acids. So when you are having high level of blood acids, when they go to the stomach, they cause that stomach pains. Now, what causes diabetes? The causes of diabetes. The causes of diabetes, it is not medically known. It is not medical known, but sources say that some are environmental and others are genetic. When I say genetic, is you the genes now you inherit from the parents, the grandparents, genetic. Then environmental factors like viruses. So viruses can cause diabetes. So you should be very vigilant with the current situation of the virus we're having in Kenya, which is COVID-19, because if you contract that, it can lead to diabetes. So that is why you're being told that those people who die or who are affected mostly by COVID-19 are those having the underlined issues like diabetes. So you should be very vigilant. Wear your masks, sanitize, so that you don't contract the virus, because if you contract the virus, you may end up having this condition called diabetes. Now, there are different types or ways how can we treat diabetes. Treatment for diabetes. So for the treatment, we have different types of treatment. The first treatment, if you are given insulin. Insulin is you inject your insulin in your body so that it can lower the level of blood sugar, because your body is unable to produce insulin. So you're given insulin, manufactured insulin. So you inject it so that it can lower the level of what? Level of blood sugar. Another treatment is called metformin. Metformin is these are glucose tablets. You're given glucose tablets so that they can lower the amount of what? The amount of glucose. Number 3, you're giving vaccines. There are these vaccines like TB vaccine. TB vaccines is said to have that component that can lower their level of blood sugar. So the TB vaccine is very important. And then the other one is diet and exercise. So there's I'll prepare a video of a diet of those people those diabetic patients, specific diet they're supposed to be taking. So among the treatment is diet, then exercise. You should be doing some vigorous exercises. Yeah, you should be doing so that your body breaks down that excess glucose. So when you break down the excess glucose in your body, the level of your blood sugar is at least maintained or controlled. Now, what are the risk factors? The risk factors. Who can contract diabetes? Number 1 is family history. With the family history, I'm talking about inheritance or genetic. When your grandfather or your mother or your father was having diabetes, you are at high risk of getting diabetes. Yeah. So family history. Number 2 is race. For the black people, we are blessed, but it is said that 80 million of white people are having diabetes, either known or unknown. So for the rest, the white people are at risk of contracting or getting diabetes. Then the other factor is environmental factors like viruses. As I've told you that when you're having diabetes and then you contract a virus, the chances of you surviving is very, very low. Or if you contract a virus, the chances of you having diabetes is very high. So I urge you, my viewers, kindly please, you check your blood levels regularly, check your diets, make sure this pandemic, it's a virus, and I've told you that among the risk factors that can lead you to getting diabetes is virus. So make sure you wear your masks. Can you follow the government protocols? Wash your hands, maintain social distance. So today I've took that short time to prepare that type 1 diabetes. In the next video, I will be telling you more about or I'll be tackling type 2 diabetes. So let's meet in our next video so that I can tell you what type 2 diabetes and what you need to know about diabetes. So may I say thank you, and please kindly hit that subscribe button, like the video, share, and give me thumbnail. May God bless you as you continue watching my videos. May God bless you and have wonderful moments. Thank you. Bye bye.